No, it's a weird one. Let's be right before they spin it. They don't get all grassy. So there's gotta be a trick on this.
I should probably sit over that way since I'm leaving early.
It's not on the calendar. What is the?
I know, I was instructed.
Oh, it's not at all. But we need to.
Okay.
The calendar invites, so it's like, I supposed to be on my calendar yet.
Nothing wrong. Might be a placeholder.
Okay, I don't see it. That's okay. I will. Unless something extenuation happens.
Budget issues.
Nope.
Good afternoon, how are you doing?
Yes.
You know, under the circumstances, I am blank.
Oh, great.
I am really sad.
Glad to hear that.
I'm on some medications that down mountain. I feel more like me.
Well, that's good.
Which I didn't.
The rest start. Let's see.
First. Hello, I want to say, how are you?
Remember me?
I'm good.
Yeah. I'm sorry I never got back to you when you called me after
Oh, yeah.
texted your mom.
Yeah.
Yeah. It's all good.
I'm glad you followed.
Is it not here?
Yeah, fine.
Do you have something?
Yeah.
Glad you're here.
You're welcome to.
Say one thing.
Yeah, I
Saw.
No, you're
On
good.
the other hand.
I just,
Supervisor.
it's just a little ray of sunshine that we don't think.
Sometimes,
So, yeah.
We're gonna look back.
Well, there's so many conflicts. That's why I don't. Yeah, then you will spend them. Yeah. No.
Make the papers this week, Laura?
Did I make what?
The papers.
I don't know. People always tell me, oh, I see you this and this. I'm like, yeah. I just put the stuff out there and that's it.
How are you doing? Well, I hope you are.
Oh, yeah, I am. Thank you.
This job. No. I've got everything's.
Laura, do you know anybody that does outreach? Like Walmart?
Besides us,
You do?
CSET does, well, we do all along the trails
Hey, we went out to the forest, met John Shoulder last week,
in Arcata.
this week. Well, I want to talk to you about that.
Oh.
Yeah, my rich.
I know, I actually did this time.
How did I end? And I walked over to a note.
Where did I?
Oh, that's a good.
I got a little sandwich. We have offices in the Bayview Heights apartment building across from.
Oh, yeah, yeah.
The co-ops, and so when I get there, I like it because I'm close to the town. Lots of places.
Yeah, right.
Yeah, the office of the VA clinic doesn't have any windows, so it's nice, the nicer office at Bayview. Ooh, I think you got your sweet. Too, good work.
No, it's more enough to be in the.
Well, I read that,
I have some. That's my condition on my webs, and I read.
dark chocolate.
Well, you know, whatever.
There you go.
I haven't executed.
What?
And they. Kelly,
Yes, ma'am.
that lady, Jen? Was it Jen Carr?
What lady? Sorry, I don't remember.
Oh.
What are we talking about?
Maybe it wasn't you. I was thinking, yeah, last week you were saying some, a program needs volunteers to serve. Maybe it was another Kelly.
I don't think it was me.
I could be a little liar. Yeah, I think it was another Kelly.
Well, I can make something up. I always need volunteers for something.
Yeah, I have lots of vacation time, I was gonna volunteer.
After what?
Oh, yes, I think it might be our partnership or something.
Oh.
Anyways, I'll figure it out. Never mind.
Okay,
Never mind.
that's mine.
They keep taking my vacation time, so I'm being creative.
It's a hard problem to have, or a good problem, I don't know.
No.
I have like no vacation time because I've
They keep
changed.
taking it because I don't take people.
One thing I miss so much is the leave time. That's I started working here for so long. I know. When I retired.
Thanks, I appreciate it.
Sick leave pay and vacation and $20,000. Yeah. 37. It was hard.
Last time, right?
Yes. And so I'm not. Nice to meet you as well. So I've been doing it.
And too many,
Oh.
already hyped and that.
Here's what you do this one. Here.
Hello?
Here, we're done.
Like, reaction. Oh, I wasn't here, so I guess it really knows.
I don't know.
You're fine.
Chest.
No.
Yeah.
It hurt.
Yeah, it does. I did, you know.
Awful lot.
Yeah. And it hurts more now than it's.
Yes.
No, I didn't. I was the table out of her truck. And I didn't. All right, everyone. It is 12:15. I would like to call this meeting to order. We are the advisory board of the Humboldt County Board of Supervisors. We meet in person on the fourth Thursday of the month from 12:15 to 2:15 at 507 F Street in Eureka. This is a public meeting and everyone is invited to attend. Members may participate remotely as well as in person. The minutes and agenda may be found by searching online Humboldt County Behavioral Health Board. We provide time for public comments early in the agenda. Public comments need to be limited to 3 minutes, made in a respectful manner, and pertain to matters related to behavioral health. This meeting is being recorded. If you have any questions, contact myself, Laura Montagna, or any of the members of the Behavioral Health Board. And with that, Joe, if you'll do the roll call.
Sean Berger. Here. Lori Baker.
Here.
Bob Doherty.
Here.
Raphael DiCaprio. Laura Montagna.
Here,
Emily Loreno. Gene Bass, excuse. Kelly Johnson.
here,
Lynette Kellerman.
Here.
Vernon Price.
Here.
Peter Stoll.
Natalie is here. Mostly. Right. We do have a quorum, correct?
Correct.
Great, let's do introduction of staff and guests. We'll start in the room and just go around, starting with you.
Good, my name is Jack Brazil. To my
Nickname, played here, I'm a deputy branch director.
Dana. Oh, I am Dana Falcon, and I'm very, very happy to be here. So thank you for allowing me.
I'm Chanel Nelson Matthews. I'm an outreach specialist with Nation's Finest, and I'm glad to be here. Earl Johnson, Department of Health and Human Services, and Analyst in Administration. Passing it to Paul.
Hi, everybody, Paul Gagne, Deputy Director of Computer Health.
And introduce.
Oh, yes, I'm Joshua Roosevelt, I'm happy to be here. Experiences with you guys.
Good afternoon, my name is Xavier Rice. I was invited by Amy and excited to be here to hear the report.
I'm Amy Scott. I'm a MSW intern with Transition AG.
Thank you. We will go to online. News. And we'll start with Suzanne, and then if you would just popcorn to someone else.
Trying to get my camera to come on. I'm Suzanne Ryan from North American Mental Health, and I will pass it on to Christine.
Sorry, my camera's having issues too. Christine Messenger, DHHS Communications. I'll pass it on to Oliver.
Hey, good afternoon, everybody. I'm Oliver Gonzalez. I'm a behavioral health program manager, and I oversee the Behavioral Health Services Act, and I'm also our ethnic services manager. And as a gentle reminder, I believe our cameras were disabled due to security purposes, if I'm not mistaken. And I'll go ahead and popcorn over to Sonia.
Hi, everyone. Sonia Lovey Boyd, her. I'm a program manager with Children's Behavioral Health, and I oversee the Humboldt County Transition AG's collaboration at the TAY division. I will pass to Jeremy.
Hi, everyone. Jeremy Nelson. I'm the Deputy Branch Director over Children's Behavioral Health, and I'll pass it on to Melissa.
Good afternoon, everyone. My name is Melissa Nelson. I'm the Patient Navigator here at Aegis in Eureka. Happy to be here, and I believe that is all of us. Am I missing someone?
I can't see if there's anyone else. If not.
Looks like Nancy and Manuel.
Hi, this is Nancy Stark. I'm the Legislative and Policy Manager for DHHS.
All right. Thank you. We will move to adjustments to the agenda. Does anyone have an adjustment other than myself? I would like to adjust the agenda because we can't have the HCTC members here who were involved with the recommendations. I would like to ask that we postpone that to the November meeting. There are no protocols, so you just.
I think as the chair, you can just postpone it.
Okay.
You're all powerful.
All right. So that is the adjustment. We are postponing that to the November meeting. Now is the time for public comments. We'll start in the room. Is there anyone from the public who's not on the board or staff who would like to make a comment? Yay.
I just want to make a comment that I did the de-escalation training yesterday with Commander LaFrance and Jacob Rosen, and it was incredible. And I would love it if like Tay in general could have, like, I think it's something that everyone in the community could use. It was engaging, it was fun, it was informative, and I felt like it really is trying to bridge that gap between somewhat competing forces, social services and police, and figuring out ways that we can learn to speak each other's language in a really full and compassionate way. So I recommend everyone do it if you haven't. I assume everyone has. It was great.
Thanks. Any other comments? in the room? Is there anyone online that would like to make a comment? Hearing no one, we'll move to action items. So we have 3 items. Yeah, I'm just gonna do them one by one. We have minutes to approve. Do I hear a motion?
No move.
Second. All in favor, say aye.
Aye.
Opposed? Thank you. Minutes are approved. You were sent the Behavioral Health Board Annual Report for 22 to 25. Would like a motion if anyone would like to make one.
Make a motion to approve the annual reports.
Second.
First and second, is there any discussion? Really? No discussion?
You did a wonderful job
No.
putting it together.
Oh, boy.
No compliments allowed.
They're very helpful. All right, so then to the vote, all in favor of approving the annual report, say aye.
Aye.
Opposed? Stand aside? All right,
May I ask a question about that?
yes.
Does that mean that, after now that this is approved, there'll be a presentation to our board of some of the activities? Is that the plan?
Yes.
Okay, great. Love it. I was asked about it recently and I think it's coming.
Yes. We had to approve it first. All right, and the last item, approval of letter to Senator McGuire. I believe everyone got a copy of that first.
Second.
Third. Discussion. There's none, I'll take the vote, all in favor?
Aye.
Opposed? All right, so that letter then somehow get to Senator McGuire. Thank you all for your support, and thanks, Martin. Are we good? Okay. So we will, postpone for a little bit the presentation, because our presenter's not quite here yet. We have moved the discussion items to next month, so communications, now the time for behavioral health board members to talk about any of the things that they would like to talk about. Starting over with Vernon.
Good morning or good afternoon, all. My name is Vernon Price, board member. I spoke with a couple of administrators with behavioral health about Assembly Bill 348. I think last month I passed out or had for documents for people to have a copy of the Senate Bill 348. I'm asking that we take a look at this. This is involving full service partnership. This is involving presumptive, prioritizing people that are coming out of jail, out of substance use disorder treatment programs, into full service partnership. I think that in this Senate bill or Assembly bill, that the county's already doing a lot of these and should be commended for doing that. But there is an option, opt out on this bill on counties that are 200,000 and less. And that does include Humboldt County. What my ask is that the Board of Supervisors would, or county staff and administration, not opt out on this and see if we can move forward. This was signed into law on October 16th. There isn't a special opt out. I'm asking the county not to opt out. Thank you for your time.
I just want to acknowledge that we're coming into the holiday season, which can be a very difficult time for many people, especially people experiencing behavioral health disorders, and also just in the current political climate and potential CalFresh benefits being ended this coming month. And I know in the work that I do, a lot of the folks that I work with are really stressed about money and upcoming holidays. So there are several different holiday food programs that are out in the community. I will share with Joe to send out to the group. And I just ask that if anybody else has any food resources to please share in the coming months. We're going to really need them for the folks that we work with.
With you? To share with you?
But just share with
Oh,
Joe, send
okay.
to Joe, and then he can
Okay.
send out to the whole behavioral health board. Thank you.
Thank you. Marjorie?
Yeah, two things. One is a piece of sad news. I don't think it was announced last time because I wasn't here, but I think a lot of us know Art Wilson, who ran HA's transitional living here for a long time. He passed away last month. Evidently, he'd had a several-year battle with cancer. He and his wife moved to Arkansas when their place shut down here. And I just heard from his wife like 2 weeks ago that this had happened. So I said I would share it with everybody here. He was on many boards in our county. He was head of the SUD committee for a while. He was very instrumental in trying to get more services for transitional living places. I wish he had lived to see that we actually have done better with transitional living now. So that's one of the things. The other thing is that, and I ran this with you already, Laura, but then at the SUD committee, I got some different feedback. At the SUD committee, last SUD committee, the thought was that we might want to develop a brochure about the Behavioral Health Board that could be handed out at various things like the September meeting. And I had talked to you about it, Laura, and you said, well, people are doing, it's okay that we duplicate what some of the other county people are handing out. Oh, and
So that was,
where did that come from?
that was at last meeting. We have a card as well as that.
Okay.
Yeah, girl.
It was part of the TAY response, but maybe we could add that to communications. I don't have very many cards. Laurel, did you bring any more? Okay, I have a few that I can pass around.
Thank you so much for doing that. I'm glad that happened.
Yeah,
It was,
when it passed them.
it was not really very awkward at Recovery Happens that we were giving out the same thing as other county things, but I thought it was good to have behavioral health, in particular, so we can get some more community members on the board, who come to these things.
Just to piggyback on that, these flyers and cards are for anybody to post anywhere in community spaces to encourage people to come as participants, and also to consider potentially joining the Behavioral Health Board. This came out of the recommendations from HCKC, but it's not only specific to transition age youth, it's to our whole community. So please take the flyers and post them wherever you work or places you go. That might be a good place for people to access them. And they do have a QR code, which is exciting. And thank you, Laurel Johnson and DHHS Media for making this happen.
Yes.
And there's the Behavioral Health Board email address now, which is handy. It doesn't all, people don't need to remember an individual's name. It's Behavioral Health Board. So, then it'll get to the executives and board it up. Makes it handy to put on a card.
So many good things happened with me just being back for a minute. Thank you. Thank you. Thank you.
Do you have anything?
I do. As of October 7th, I was offered and accepted to another position as nation's finest, Cal Vet. CVHI, California Veterans Health Initiative, has opened up 3 different stations across the state. And they have your new veteran peer support. We have a dedicated team member here, the Chandel. She's the outreach coordinator. And as I was talking about previously before, we are driving that mobile service unit around town. If you see us, wave at it. Because we're out there, and primarily right at this point, we've got 8 counties to cover. But primarily what we're doing here at the beginning is street outreach every day. We're looking for the big things about this program is that we have a clinician on site, and we offer mental health services to veterans, family members, wives, widows, not grandchildren. But we have a clinician on site, and we also have the MSU. Hopefully, the Starlink is going to get hooked up soon, so that we go into remote areas we can do teleconference.
Yes.
So we have that, and so we're out there hitting it every day. We do some street outreach, some days longer than others, but we're on the street talking to my boss, Paul. And he says that's always needed to be done, and it's never been done right. So we're gonna attempt that. And I'll introduce Chandel here for a minute, give her a little introduce herself.
I'm Chandel. I was hired as the outreach navigator, outreach specialist, whatever you want to call it. I go out with Bob, and our goal is to bring veterans, their family members, wives, children, husbands, whoever it might be, in for mental health counseling, if that's what they wanted. They can do individual or family counseling. The veteran can do online counseling with other veterans if they would like. And really, it's a great program because the veteran does not have to participate. So if the spouse or the children want those services, the veteran does not have to participate for them to get those services.
Well, the big thing about this program is discharge status is irrelevant.
Okay.
So, and the other thing is that I'm starting Monday, I'm in a 80-hour training with certification. It's a big deal.
It's a big deal.
So I'll be a certified veteran peer support. So if you know anybody, I'm gonna put this out so it goes out into the community here, but so everybody here knows a veteran, has a neighbor who's a veteran, has a family member who's a veteran, knows somebody who knows a veteran. So, this is a relatively new service here in town. And the big deal is we have an on-site clinician. That's the big deal.
Is it just, mental health, or could it be like hospice?
It's primarily mental health services, but because I work for Nation's Finest and know the inner workings, under our umbrella, we also have Cal-AIM, we have SSVF, we have transitional housing, we have all of them stuff. So one way or another, we can get them plugged in.
I have a question.
Ellen, our office on Third Street. Yeah. Well, actually, if I can get, but
I'm leaving a little bit.
I don't know.
Thanks, Bob. Yeah, if you can exchange info. Matt, do you have anything?
I have, so my,
I'm not in a meeting, sorry.
I am in a meeting, but not that meeting. So I have some concerns. Again, we're really struggling, with getting assessments done from the jail. One, because there's no jail staff to answer the phones to get assessments done. Two, Medi-Cal, the Medi-Cal is,
paused, so programs are not doing assessments for clients that are in the jail. And three, I'm now hearing that programs outside of the jail, even if they get Medi-Cal reinstated once they get out of the jail, are not going to be accepting client, well, one program is telling me this. They're gonna have to go to sober living once they get out of jail and get their Medi-Cal reinstated until their partnership gets reinstated because they're losing money. So it's just becoming a struggle after struggle, so I just want to talk about that a little bit and see if we can come up with a solution. I mean, it's not the only program, but if it's already starting, I just want to make people aware, we need to come up with, start coming up. Food for thoughts, think outside the boxes, anyways. And I've been asking this for quite some time about the Medi-Cal, how we can, at least get the assessments done. I think outside the box as far as getting the assessments done without the staff at the jail. But, when programs will do it without the Medi-Cal. But, yeah. We gotta be able to figure out how to get at least a temporary reinstatement of that Medi-Cal to do the assessments for people to get into treatment or something.
Would you mind elaborating on what, like,
So while people are in jail, there is a pause on their outside Medi-Cal. They have an inside Medi-Cal and an outside Medi-Cal. Am I explaining that correctly?
Yes.
So there's inside Medi-Cal and outside Medi-Cal. Medi-Cal on the inside is different. And so while they're in custody, the Medi-Cal that the programs accept on the outside, does not cover an assessment.
Okay, so you want to look into it further?
Yes.
Okay.
are you wanting a report for this board? On
Huh?
are you wanting a report for this board on how that works? I mean, I think a lot of us are sort of.
Well, I've been talking about it for a long time, but it's really getting detrimental. And we really need to figure out how to get this resolved. Because now the more, things are getting cut, the more detrimental this is gonna get. Because now we have short staff in the jail, we don't have people doing the actual job of linking people with assessments. And so I'm just concerned,
So Kelly, do you have some insights?
I do, and it's been a while since I've seen the jail behavioral health service, so I don't wanna speak on behalf of DHHS, but, Laurel actually helped us find some workarounds for this years and years ago around how to get people ASAM assessments, which is what's needed to be able to go into residential treatment for substance use disorders. I understand your concern about the staffing. I think we have a presentation coming today about SUD program. So I wonder if we might be able to table that as a question for the presenter around how we might be able to get substance use disorder assessments done for people in custody to streamline their placement into their residential treatment programs on release. Does that sound reasonable?
Sure.
Cause they'll be able to hopefully, is it Deanna that's presenting? Yes, so she's the substance use disorder administrator for the county. So she should be able to help us talk through that.
Yeah, and also, you're talking about, there's not staff in the jail, or is it a particular program you're talking about?
Archie's gone.
So you're talking about behavioral health staff, so yeah, we have some vacancies in the jail, but we still have clinician and medical staff from psychiatry and nursing that are operating in the jail.
We've been calling to get people to giving assessments for clients. Nobody's answering the phones. So we can't get assessments done. which means people are getting stuck in the jail.
And I know the jail does have an MAT program too, so that's still in operation. And that's still happening and so.
Which is medication assisted treatment, but how do we get them out of treatment for mental health diversion?
Well, what was that question?
That's medication assisted treatment, but how do we get them out of custody for mental health diversion?
They
Well,
get
we can't
for,
get
for diversion and we have a
But we
diversion
can't get-
team that's separate from the jail team that's fully staffed. So we can, we
But
can talk.
there's a certain criteria.
So
That's correct.
here's what
Correct.
I'm gonna do. So if you have some written specific questions, you could give them to the executive committee. We
Okay.
can put things on the agenda, ask for somebody to specifically address.
Yeah.
Ad hocs, these are the processes. To handle those.
Okay.
questions. Well, that's okay. Awesome, thank you. Sean,
Group hasn't already been discussed.
do you not want to announce any meeting, press conference that you went to? I don't think. Okay, I just need to go back. All right, well. I guess it's me and you. So I was so honored to be invited to a press conference with Senator McGuire and was glad that he had a one sheet so that I could make sure that everything was covered in our thank you letter to him. But that was quite wonderful and it was great to see all the partners there. And I think that's all that I have to say. Gee, man,
Thanks for being there. It was great to look out and see some big mental health members there. I also had the privilege of being invited to that press conference and was asked to speak about partnerships in the community and I had some, I probably would have spoken a little more from the heart, but I got some scripted notes. That's okay. I did a merging of the two. But it was lovely to, be part of that, just celebrating the fact that, Senator McGuire has been able to bring home some additional funds to his district around facilities for behavioral health, sorrel leaf, and the triage. So filling some gaps there, and my understanding is that helps the sorrel leaf project get over their funding finish line. And the behavioral health facility still has some needs, but it's gonna get us closer, right? So, yeah, he just spoke from the heart about why it was important to him and his family, so that was really, really nice to hear. His time as the Senate Pro Tem, President of the Senate, is sunsetting in late November or mid-November, but I think it's outside of the step of anyway, the timing is perfect for us to send him a letter now and to just really share him. So that was really nice, and it was great to meet. I had spoken about the sorrel leaf project with folks before, but I hadn't met the person in the kind of driver's seat there, so that was really cool. And meet several of the sorrel leaf board members. Really cool. Review the behavioral health services and healing.
First of its kind in the state.
First of its kind in the state, so really cool to have a local project that's like paving the way for something different for you. And I got to participate in a conversation last night. It was a workshop held by the Human Rights Commission. They've been having a series of community trainings around constructive conversations, and I was able to participate in that. Share tips on constructive conversations, and most importantly, hear tips from other people on holding constructive conversations. So that was really cool. The Human Rights Commission is really trying to make space for people to talk across differences, which is super important. So that was really good. Obviously we have, because the lapse in federal appropriations were coming up against, I'm sure everyone has heard, the, time when, benefits in November will either be delayed or people won't get them, in any timely fashion. So I think we're gonna have a lot of folks that need food and that need community resources, but I do want to kind of remind everyone that we have invested a lot collectively in having the 211 system in place. And so I think people maybe it's been around for a while, like I kind of sometimes forget about it, and then I'm like, oh wait, all those resources are in one place. And you can call and get access to them, or go online and get access to them. And it's just a repository for all that information about everything from food and housing and shelter to mental health resources and more. So please do share that 211humboldt.org or call 211. I'm trying to find folks to get that out there. And I think that's, I mean, I think I'm gonna have more updates at our next meeting, but I appreciate the, what you brought up, Vernon, around Assembly Bill 348 and, full service partnerships. And I do want to just make sure I get more information from staff about what our engagement is with that, because there's, at the end of the legislative session, that's often kind of a barrage of, okay, these things were signed and now we figure out how we are going to implement them or how we're going to adapt and what we have capacity for. So that'll be good to more information about it. So I'll follow up with staff members to learn more. So I heard you. So
Thank you. Report. DHHS Director. Behavioral Health Director is not here. I don't believe Connie's online.
Connie's not unable, Connie is unable to attend today. She sincerely relays that you guys should know she'd much rather be here with you than doing what she's doing, which I don't know. But she would much rather be here with you guys. It was a last minute thing that she got called away to her. Please.
Thanks, Laurel.
I have a few things for her. She just wants to thank the board for joining at the press conference and being a part of that. That was much appreciated. But also the participation of our visit from the California Health and Human Services deputy, who came up with some folks from the Department of Healthcare Services to take a look at Humboldt and why Humboldt is standing out compared to other counties its size with regards to care court and care court petitions. So they were really interested in what we were doing, and it was a good meeting, I think, and it was so good. They asked us to be on a panel the following week in Sacramento, so that went well too. We were on a panel with Alameda County and Stanislaus County, and sharing what's working and what's not working with care court across the state. So that was really good and good experience, and I think helpful for us to see how other counties are doing things. And then she also wanted me to let everybody know that we are interviewing a medical director. So we've had two interviews with two different candidates over the last few weeks, and one of them was just this last week. And we, I think would like to move forward with both of them, and so we're starting that process. Currently, we're having Dr. Simpson, who's interim medical director, has been doing a fabulous job. But she's moving on too, but she's gonna hang on long enough for us to get another medical director. So I'm really excited about this candidate, and hope things come together nicely for us.
You.
If I may ask a question. Where do we stand with our patients' rights advocate position being open or available? Is that been available, or has someone been, looked at, or can you give me an update by any chance about where we stand with the PRA?
Yeah, I believe we have a short-term support in the works. Is that right, Jack? So
Yeah, we have a part-time
temp position, that's being filled because of background clearance.
That's right. And then I believe, I don't know for certain about the position itself currently, if that's open recruitment or not, I don't know. And I also know that we're considering contracting that service out to another entity that is well known around the state in providing that service.
Thank you.
Jack, deputy,
Yeah, probably don't have too much.
thing going great with Aquarian, Billabong, all those places.
In the sense that nothing's going bad.
That's good.
So, all that's good.
Those stories.
There's always stories.
All right, I notice I'm coughing a lot because the air conditioners are turned on and it's blowing right on, so I apologize for that. SUD committee update, do we have one?
We do. So we met on October 9th. We had, Binka, which is a ECM program in the area that came and shared what they do. It's called, it's enhanced case management. They provide, CalAIM, partnership health plan coverage. And they have, one or two physical people that are in this area. Most of their people are across the states. I would personally was able to, I have a client that lives here, but he got in a motorcycle accident. In Santa Cruz, and so I was actually able to call and have them meet with him down there. Anyways. So it's kind of a cool, palliative care navigation system. Anyway, so they came and showed what they do. Our next committee meeting is November 13th. And we will have a little educational thing. We'll have Dr. Stockton from Public Health come and talk about fetal alcohol syndrome, which will be kind of exciting. And then we'll have another presenter, Amanda Steinbeck, which used to be an intern at Healthy Moms. She's now a parent, I guess they call it a parent partner. There, she's gonna be talking about ACEs. I think it's important that we educate our community on some of the residuals from fetal alcohol, drinking while pregnant or anyways, the residuals from drinking or doing drugs while either pregnant or raising a child. Also, for those, and I forgot to ask you where you want to meet next week. Okay, so, we've been invited, to go and do a walkthrough, to the Hopa Sober Living. Next Thursday, I'm hoping to leave hopefully at 8:30 a.m. And we can, discuss where we're gonna meet. They have a sober living in Hoopa. And, I'm kind of excited. They've been asking me to come up there for a little bit. But I thought it'd be great for us to come up and do a walkthrough. And not only, I believe that it's important for us as a community to embrace our tribal members. We have a lot of people that need our support. As well as DHHS, needs to see what's out there too. So, I don't know if I said that right, but anyways, I never say things quite right and I apologize. So if you wanna go, we'll probably take a couple cars, whatever, and go up there next Thursday. We'll leave about 8:30 in the morning. And I think that's about it. And if you have any questions, please let me know.
Thank you. Committees. I think the only thing very executive committee has, we do have an application. From a Tay, a very interested Tay, who I met with personally, but would like to meet with the executive committee, so that person is ill this week. So hopefully next week, one of the two of you can meet with Jess. So that's exciting, very excited Tay member. Need all the Tay we can get. No pressure. Vice Chair, do you have anything? I know, I feel like
I've already said it all.
you said it all. How are we looking on our presentation, our presenter? Right. Oh, my goodness.
Oh,
Any navigation center, business triage. I forget that I go to a lot of meetings and it's talked about, but I have to always remember this group only meets once a month, and so there may be other things that that we know about care board or crisis triage center, but I don't know that there's any new updates on navigation center. Nope. Okay.
The grading permit was issued
Oh, there
by
you
the city
go.
of Eureka, and there was grading on site.
That's good.
that's something.
That's the thing that has happened. So if you go by the site, it could look like active. I think it's been confusing to people that they think the project's like accelerating quickly. Still waiting on quite a few things, but that piece happened, which is great. And that would needed to happen before the end of the sort of construction window ideally, so that other things can happen later, but now it's just sort of a site that has been graded. So if you go by, don't be fooled. It's still in practice.
It's something. It is something.
I got excited. I got excited.
Oh.
Jeanette, can I ask you something?
Absolutely.
Have you heard any more about the project that Raphael is trying to do with the?
It's being postponed a little, at last I heard it's in December, possibly a little bit longer. There's some, repairs that need to be, done that were, beyond their
means? Financial means.
Yeah. They're working on some, I was gonna send them a potential donor. Someone I use when I have my sober living down south.
Thank you. So our presenter is on her way. So if there are any future items. Anybody wants to bring up future items for the agenda? Yes, Laura.
I wouldn't do this except we have some time, and so my productive vamp is, I am getting some more of those flyers printed out right now. I won't be able to do more of those business cards right now, but can I get an indication of how many and who wants them? Maybe what I'll do is I'll pass around a piece of paper, and if people can, who want the business cards can write their name and the amount on them, and I'll figure out ways to get them to you.
I keep offloading mine to other people, so I can keep all of them.
I totally understandable
I can't help
and
myself.
fine. I
Also, does anyone know where I can get the little red parts?
Red cards?
The ice cards first.
Oh,
Centro del Pueblo.
Where?
Centro del Pueblo.
In Arcata?
And then like Paso y Paso, might have them too at Providence.
Well, I'm like,
That would be at Providence.
okay,
We'll
well, thank
definitely
you.
have them.
I live in Scotia, so I'm not sure.
Yeah, first 5 Humboldt, we also have the Southern in Eternal.
Thank you. I just think.
Haven't
we're
checked
going
to see
for
when
last one.
All right. I'm going to care court.
Please stay with presenters and be your short.
Yes.
Get some water.
Yes, let's take a 5-minute break and then come back when the presenters here.
You call Pella.
Okay, how come upstairs? How did she? Oh, there she is. Oh, they're always You don't have to say hey. I'm doing today. How about you? That was fine. Great. Thanks for on Friday. Okay. Just staring at what we just gone through the good guys, so. So I'm the last one? Yes.
Yeah.
Perfect. Well, I'm sure you've been saying why the delay now.
Yeah. It's kind of Monday to get all that.
Okay, people in there. That's fine.
No, he has the senior, but maybe he wants
Joe,
to tell.
you know if they were able to
Or phone.
Okay, good.
They didn't watch my hair, so
We've been having that.
I'm really, scrolling with that.
I'm gonna go.
It's like no, it's Big rush for life today.
Unless you guys prefer me to be someplace else. Wherever you're comfortable here.
I like it.
I know we're so on a grass to different, blowing on us at Humboldt.
Exactly, it's the view.
Yeah, I've seen some color time in Florida. I guess it's Florida. I'm speaking. Twice in 1 week.
Oh.
If you want that, then pass them down.
How are you doing?
Your call out right by on one of those ones.
I got one for.
Does the job, but.
Yeah.
Okay.
Behavior health working.
All right.
I need to cancel those 2 tickets. Rhonda's gonna be out in the Hope Center. And she's our coordinator of what outings events. So, I'm so sure that that's not gonna be.
Right, I'll let the folks know.
Thank you.
All right, we're back. We have our presenter, our lovely presenter, Yanabe.
Hello, everyone. First, I am so sorry for my voice. My voice comes and goes as it wants. And today it's decided to be this weird mix. So my apologies for that. If I try and increase my volume, it will go out further. So I'm gonna do the best I can for this presentation today. Second, I'm also sorry for getting here delayed. As with all things in the mental health field, sometimes our schedules and our days are unpredictable. And today was definitely that for me. But the great thing is we're doing the good work that we are all here and that we intend to do. So with that, we'll start this presentation. So feel free to ask me questions along the way. I'm going to give a brief overview of the programs that I oversee and then some updates that are coming kind of from the state level, and then we'll have a spot for more questions. But if you have something along the way, feel free to interrupt me and we can chat about it. Sound good? Excellent. Okay, so Joe's going to be my clicker. So we're going to go to the Family Wellness Court. So the first program I'm going to tell you guys about is the Family Wellness Court. And I went onto their website and stole their symbols. So Family Wellness Court has these equal shares of the pie. So we have our tribal partners and the tribe. We have CWS. we have the court system, because this came out of tribal court. We have the participants themselves, and then we have our behavioral health pie. So obviously, we are part of the behavioral health pie piece, and that has a clinician and case manager associated with it. And those try and work as transparently as we can and as seamlessly as we can with all of the other individuals. So we have Yurok Wellness Court, Humboldt Wellness Court, and State Wellness Court. So for individuals who are a part of the Yurok tribe, they would participate usually in Yurok Wellness Court. For individuals part of Humboldt tribe, they would participate in Humboldt Wellness Court. For the many, many individuals that we have in our community that don't fall under either of those, they usually participate in State Wellness Court. Slide please. So Family Wellness Court was a total collaboration between Tribal Court, CWS, Behavioral Health, and County Council, and many others. I'm sure that happened well before I was in my current role, but I know that it was totally done at a collaborative level where everybody was having equal buy-in with tribes and our tribal partners and our tribal courts, of course, being one of those leading factors. So in the Family and Wellness Court documents, I found this vision and mission statement that was taken from the Humboldt Wellness Court Guide. So this was created with all of those partners in mind. So the Family Wellness Court vision is children grow up in our community state safe, healthy, and culturally grounded families. And the mission, the new court is committed to cultural humility and lifting the cloud of despair and pain of Huba families, empowering them to make healthy decisions and break the cycle of addiction and child abuse and neglect by providing a path to recover, heal, and grow through a coordinated and respectful family wellness team approach, a comprehensive, culturally competent, and community involved services, frequent monitoring, and a system of support for family recovery and child well-being. So like I said, I took this one specifically from the Humboldt Court. The others are very similar. So I want to make sure that you know that there might be slight differences, but I didn't include them in the slide. As that coordinated effort, we work with families and with the courts through 4 phases. And that is a ton of engagement. The first phase is all about trust. The individual's trust with the team's trust with the individual, and really establishing a coordinated baseline, which includes being oriented to the program, getting their mental health assessments done. If they need a substance use assessment, getting that done as well, and starting that stabilization process. That usually takes between 30 and 60 days. That's the minimum. I have seen that take a lot longer, but everything is built on that foundation of trust. So if we can't pass that first phase, then I'm not going to be as successful in the rest of the phases. So the second phase is belonging and family, and it's returning to healthy connections, education, service planning, belonging in Family Wellness Court, belonging as a part of the tribe. The third phase, and the Family Wellness Court decides the team. So the courts and our tribal partners and CWS and Behavioral Health all decide if the individual working with Family Wellness Court is ready to advance phases. So it's a team approach, team level setting, team knowledge to help support families in a different way through our court systems and being restored with their children if possible with CWS. The third phase is settling up, and that's, again, the language that they came up with collaboratively. And so it's taking responsibility, it's opportunities to start giving back and provide feedback, not only for them getting feedback from all of the rest of the partners, but then also providing feedback for what's working well, what can be improved on, what other things are needed. So you can see the minimum duration for that phase as well. And then they're really trying to get the goals of clarifying the role that substances have played not only for themselves, but in their family. And identifying sources of strength in order to move forward with sustained healing, finding anything to add sources of strength to that family connection and that unity and to themselves as an individual will just help them continue to move forward in positive ways that they're hoping to move forward in. And then the fourth goal is that generativity. And that's the maintenance and transition to lifelong healing. So that is after all of the phases a family wellness court has done. They have met all of their goals for CWS. They have met all of the goals that the tribe has asked of them, and they've met all of the goals that the court system has asked for them. And again, then they'll have a great celebration. Family Wellness Court has a tendency to want to celebrate positives. So they have, I think 4 times a year is the goal right now, where they have shared meals in the evening. They take turns cooking. They give back to their community. So that transition and give back piece is also former participants coming back and walking with people through their cultural activities and on their growth journey. I think we're ready for the next one. Any questions about Family Wellness Court before I move on to purely substance use?
It's new or it's.
Family Wellness Court has been around for a few years.
Okay.
So, and it's, when I was looking at the literature, getting ready for this, they were talking about how Judge Abby was really instrumental in helping create this new way of court systems working for tribal communities and tribal members. So the idea is, instead of it them being up where judges normally sit and looking down, they sit around a table or they sit all at eye level to try and remove some of the barriers from that have a tendency to dehumanize and make people feel less than. So it's really a collaborative effort that feels really supportive.
Well, I'm sorry, not the Euro Wellness Board, but the one here in Humboldt, I didn't realize there was a state one too. So
There is a state. So all 3 of those are here at Humboldt. So we have, and the staff for behavioral health are the staff that are involved with all 3. So the judges are each involved with their own, and one is also involved in state. CWS usually have it divided by who they're involved with. The courts obviously by location, but our behavioral health team is the one that is that unified thread through all of the court system that makes it so they're touching all of the families that are in any of those courts. So, yes.
I have a question, wondering how the integrations happening or could happen with the new benefit related to traditional healers, that is reimbursable, or is what you outlined with, I know there's a lot loaded in this.
There is a lot loaded in
I'm
that.
really curious about what those are. I mean, I bet you they're amazing, but is that all managed and handled in like with an internal team or internal to the court team, or is it where they're bringing in traditional healers from the tribe to?
So the traditional healing benefit is specific to Thread Medical Organized Delivery System.
Right.
And that we'll talk about in a little bit, and that's if they're part of a substance use disorder treatment program. While this program totally supports and encourages and gets people involved, this is for our behavioral health system, which is, doesn't necessarily have that substance use treatment component.
Gotcha.
Yes, Laura.
I love stats. I love numbers. Is it a place to find numbers of who has gone through this?
A great question. Probably, I'm not sure where those would live currently.
Okay.
So, but that is something that I would be interested in finding out as well.
And one other thing, since I'm focused on Humboldt County and how cool we are, where are there other in the state family wellness courts being?
Also a great question. If my brain wasn't quite so focused on the situation I just left to come to here, I might be able to pull that information, but right now that is not coming to me.
Sacramento has it.
Sacramento, and I know a few others do as well. Yes, Kelly?
I just wanted to piggyback on what Paul was asking. It doesn't have anything to do with reimbursable traditional healing, but the tribe's wellness court staff are providing a lot of those traditional healing services as part of their component.
Right.
So the tribes have their social workers and their case managers, and they also have peers that come around and support. CWS has the social workers, and they're also trying to get some peers involved. Behavioral health has our clinician and SCD counselor that are involved with their treatment, but clinician and case managers involved. And we also link currently back to tribal healing. And the court sometimes suggests that. So one of the beautiful things about family wellness court is if someone on the team says, oh, hey, this might be a really cool thing for the individual to participate in. Hey, there's a camp out and they don't have a tent or any equipment. Then the team will problem solve that, like who can get them the items needed so they can participate in the cultural activity, which is really kind of a beautiful way to approach it. Big fan.
Wellness court staff from, I know, I'm seeing New York Wellness Court because I worked there for 2 years, but they will have staff that will take participants like for ceremony and so like they'll help them get the camping gear and accompany them there. Make sure that they understand protocol and are there in a good way and all of that, which is really, it's really special.
And I am super excited right now. We've just hired on a new case manager. So currently our clinician in family wellness court is enrolled in one of our local tribes. And we have a case manager who is also involved with the tribal community and a part of it. So I think that having our behavioral health team be able to understand and assist in ways that me as someone who doesn't have a Native American background can is really beneficial and supportive. Okay, so our substance use disorder treatment programs. There are 4 county ran treatment programs. There's Humboldt County Programs for Recovery. I will often refer to that as HCPR. So if I say that, know that that's the one I'm talking about. Adolescent treatment, which is for individuals who are ages 12 through 18. Our Healthy Moms program, which is a perinatal program. And then our dual recovery program, which is for individuals who are open to county behavioral health and they have the co-occurring diagnosis. So it's both mental health and substance use disorders. Humboldt County Programs for Recovery, Adolescent Treatment, and Healthy Moms. The individuals are not often open to county behavioral health. That is a service for what we used to call our level 2 and 3 clients, where dual recovery is for our level 1 clients. And all that means is whether they're served for their any other services would be in the community or through county behavioral health. Any questions about that? All of our programs that are part of the substance use disorder treatment program for HCPR and adolescent treatment and Healthy Moms, they all, in order to get services through them, the individual has to have partnership. So they have to have that direct Medi-Cal benefit. I have Medi-Cal also listed under Healthy Mom because Healthy Moms also sometimes opens people up to behavioral health and then does more of that counseling piece. And they also have individuals who work with moms and littles on parent-child counseling. All of them provide similar levels of care. So in the substance use disorder world, we have this spectrum of level of care from residential and detox down to recovery services or early intervention. So the outpatient teams for HCPR and adolescent treatment and Healthy Moms all provide intensive outpatient, which is 9+ hours per week. Regular outpatient, which is less than 9 aftercare and recovery services. And recovery services can be utilized at any level of care. And I'm sure that's gonna be redundant here in a minute, but we'll still talk about it. I'm ready for the next slide. So the substance use disorder treatment program. So ignore dual recovery for a minute, because that is again open to behavioral health. So the programs that aren't open to behavioral health are what we call the wellness and recovery model. It's a regional county model, and there's 7 counties that are a part of the regional model. That was created in order to reduce barriers for clients, not only in our own county, but for other counties to access services. So if I have a client who's part of HCPR and they need to go to detox out of county over in Reading, so we can now facilitate that without the individual having to change their county payee, county responsible on their Medi-Cal. So it increases the ability to quickly get our clients served without additional barriers that if they're not part of the wellness and recovery model, that they would still have to face.
Yeah, and I see the county symbols there, but can you just say out loud what the 7 counties are?
Sure, it's me. I had them listed, well, they're no longer listed alphabetically. I had them initially, I must have changed that at some point. So it's Modoc and Humboldt, Siskiyou, Mendocino, Shasta, Solano, and Lassen.
Okay.
If there are individuals who need a program that's not in one of those counties, then we work with partnerships and we do a single piece agreement, and then they're still able to get services. It's just a longer and more convoluted process than if we're able to serve them within those 7 counties.
So not Trinity then?
No, ma'am.
Or Del Norte. A lot of our.
Del Norte,
Surrounding counties opted out.
so Del Norte opted out, which is unfortunate.
Yeah, it's a huge.
And one of the things that we do have that now is open to individuals for Del Norte is, it's not my program, but I'll tell you guys about it because it's really cool. Aegis has just opened up services in Del Norte County. So prior to this last, I don't know, month or so, individuals for Del Norte County were coming here for mat treatment daily.
Yep.
And we're just recently, within the last few weeks, they have now been approved to have a site open in Humboldt. So all of their prescriptions come through Humboldt and it's still billed through Humboldt, but they can get provided their medication for mat treatment out of a site in Del Norte. So we are again doing everything possible to reduce our barriers to clients getting the help they need. So. The first program I'll talk about is Humboldt County Programs for Recovery. We kind of briefly hit on it. So it's for any adult who is seeking treatment, who doesn't meet the qualifiers for perinatal services or for mental health services, are eligible to be seen at Humboldt County Programs for Recovery, with the goal of empowering people, emphasizing their self-awareness, and creating meaningful changes in whatever way that they see fit. We are located at 2nd and D. So the address is 231 2nd Street. So it's right across from Roy's, right? Like it's right out there on that corner, right across from Humboldt. Exactly. Which is really a fantastic location. So most of our adult programs and staff work on the 1st floor. And then we have groups up on the 3rd floor in that building. So the way to access services, if we used to send everyone through Carillon Partnership, if they haven't already, is now taking that number back and is putting it back under partnerships umbrella. So if they haven't done that, they will in the next month or 2, but it's going to be the same phone number. So I just updated the slide as if it was the same, because nothing is going to change for people who are calling it besides who they say is answering the phone. So you can still do that. You can still call the program directly. You can pick up information in person. You can ask us to send it to you, and any part of our community partners can refer somebody for an assessment and for possible treatment. Joe, do you want to advance for me? So we are primarily group based. We do provide individuals as needed, but staff right now are providing 15 groups per week. And those are divided by the type of group or the group name that we've given it. So our extended outpatient meets 4 times per week. The rest of them, all the way to aftercare, meet twice a week, and then aftercare meets once a week. So we are doing everything possible to give people a variety of groups to attend that would fit their schedules, their needs, and their ability to participate, including an evening recovery group that meets from 5:30 to 7 twice per week. So for individuals who are still able to work full-time, we also have a group that they can attend. Yes, Vernon?
I have a question. I keep hearing aftercare. Can you tell me what that may look like?
So aftercare is for individuals who have successfully been through a treatment group in whatever way that makes sense for them, right? So none of my programs are 100% abstinence only. So I really believe in harm reduction. And so that means that people can complete group in ways that abstinent only programs, they might not be able to complete the same way. So we asked individuals, what's your problematic substance? How can we reduce or stop using your problematic substance? What does that look like for you? And then after they've met their goals and we've walked with them through that process and they're ready, then they're like, okay, I want the next step. And the next step for me is support around relapse prevention, support on how to increase their coping skills beyond what we've already done in group. Maybe how to do a budget, how to re-engage in the community, how to either get the education or re-enroll in school or re-enroll in something so they can get the job opportunity that they're hoping to get. So it's all of that. You know, we have the baseline recovery, which is fantastic. And then it's what's next. And so the aftercare for me, and what I try and have our staff do is the what's next part.
Exactly. Okay, thank you so much, because in where I'm at in the community, I keep seeing the same faces go back into the same atmosphere without the after support.
Right.
And that's what I'm glad to hear. Thank you so much.
Right, they're very welcome. And we just kind of talked about all of that. So are there more questions about levels of care? Yes, ma'am.
Like, what's the capacity for the individualized treatments? Like, if somebody wasn't suited to groups for reasons or whatever, like, what's your capacity for like being able to be individually?
So we do that on a rare occasion when individuals need it. So it is really a case by case basis on how that looks or how that's approached. Some individuals come in a couple times a week, some come in once a week, and then some we might be like, oh, we can see you every other week or maybe once a month, right? So it's very tailored to what is needed. But I will say with that drug Medi-Cal services, so this organized delivery system, it's DMC-ODS. Drug Medi-Cal organized delivery system is what that stands for. And that has some really rigid rules to it. So if somebody hasn't engaged in 30 days, we are required by the federal government to close them to services. So, well, we are as flexible as we can be. We also have some really rigid guidelines that we have to adhere to. The behavioral health side is way more flexible in what we're able to accommodate. So, and if someone's working with us, like, oh, I can't make it because of X, Y, and Z, we don't consider that they haven't showed up because they're still engaged.
I would say too, from my experience as a former alcohol and drug administrator in Sacramento County, that for many, many years, there's only been certain reasons you can see people individually. Drug Medi-Cal is a group-based process, and there are things you can do individually, but they're only for very specific reasons, and you're not supposed to go outside those reasons.
That is true. Kelly has opened up that a little bit more, so we are able to have a little bit more flexibility with that, but it is still primarily all group-based.
Are the groups open or closed?
As far as you have to be invited to attend your group.
Okay.
So you can't attend one group, like, unless it's your plan, right? Like, I can't just bounce around from group to group, coming and going from each one as I so desire. But if someone is needing, it wants intensive outpatient and wants the 9 hours per week, they might do extended outpatient and our moral recognition therapy, which is MRT, or they might do extended outpatient in our women's group. So we can customize it in that way, but they're not, all groups are not open to all participants.
So I guess what, groups sometimes have a structure and process, so, and it's disruptive if people are coming in group midway through the group cycle. Do they all have to start at the same time?
They do not.
Okay.
So great question. And I know that there are some therapies that do that. We do one, it's some helping men recover and helping women recover, where there is a 2 or 3 week that's really intensive. And so for that, we may delay someone's entry by just 2 or 3 weeks, just so they're not coming in hearing about everybody's trauma as their first, and the people telling about their trauma don't have somebody in their room that they don't trust. But that is really the more rare side of things rather than the norm.
What is the admin process like for someone to call and receive services? What does that look like?
So they call, they inquire about services. We will do a brief screening with them. If they appear to meet criteria for the brief screening, we will either have them stop by or we'll mail out a packet via email or by snail mail. They will fill out the packet and return it to us. We will have them do an assessment. It's an ASAM structured assessment. And then they're put into groups pretty immediately after that assessment.
So it
process.
sounds like maybe like a week or maybe 2,
Yeah,
depending. Okay, because I was thinking in terms of, sending people your way, how long that might.
pretty quick. It's a pretty quick process. And once their assessment's done, the assessment really is the one of the keys, right? And once that assessment's done, they can start groups the next day. Okay, I think we're all done with HCPR. The next one is our adolescent treatment program. Our adolescent treatment program is primarily individual based currently. So it's working with the youth in our community ages 12 through ages 18. We have the supervisor is a mental health clinician, and then we have substance use disorder providers who go out into the community, go out to schools, go out and meet kids wherever they are in order to provide services. We also have one who's involved at juvenile hall who does groups for New Horizons. So they're, New Horizons twice per week. So similar goals, and for youth, they do not have to currently have a substance use disorder. They don't have to meet that threshold or for criteria from the DSM in order to receive services. They can just be concerned of their use or just be using and want to stop using. So it's a preventative base. We also have clients who are actively using hard drugs, and we're also working with it. So it was kind of a rainbow on who we can treat and how we can treat. They are also housed at, I think they're all, I think we can skip that one, go to the next one. They just have to be eligible for partnerships, so they will help them get involved. But then we can go to the next slide. They're also housed at Second and D. They do have their own lobby and their own entrance separate from the adults. So people can go through the adult side and we can take them over to the adolescent treatment side. But it's the second part of the floor for the first floor is dedicated to adolescent treatment, and it is its own area. And I think, are there questions about adolescent treatment? Healthy Mom is our perinatal substance use disorder treatment program. So for women who are pregnant or who have a child under the age of 6 years old, Healthy Moms focuses on helping participants treating their substance use disorders and supporting them to become healthy, productive women and mothers. We do that for a variety of ways, but that is housed at H Street. So it's right across the street from Semper Virens and that campus. again, we have all of the things we can to support moms, including having a cooperative childcare on site. And why I say it like that is the parent has to be on site in order to have their children in for childcare. So we're not able to provide childcare for anyone who is not in our building. Healthy Moms has its own, you can go ahead and go to the next slide. Healthy Moms has its own criteria for how to help individuals and what we're able to do. They do a lot of individual and a lot of groups. Well, the group at HCPR meets 4 days a week. They meet for 90 minutes. Healthy Moms meets 4 days a week for 3 hours per day. So it's really an intense supportive program. They provide breakfast to the moms and to the children when they arrive, if they arrive early. So they have a whole breakfast program, and then they support moms dropping their children off at the childcare if needed, and then having support throughout those 3 hours. They also have an outpatient program and aftercare. They have mental health counseling as well. So it's more of a whole person picture program.
Can I ask, someone who's unhoused and on the phone, I think struggles to be part of that program. There's nothing really else.
So they can participate in multiple ways. So yes, that can be. We also have individuals who can provide reps. So I will say that hesitantly, because our parent educator unfortunately had to resign due to some other stuff that was going on. So we will be getting a new parent educator, so then we'll have more capacity. But we try and do our best to give bus tickets or offer support or do the partnership rides. We also have it's kind of like an early recovery group. I don't remember what exactly they call it. So for individuals who are actively using or not ready yet for the intensive 4-day-a-week program, we also have a group that they are invited to participate in. So Healthy Moms also tries to do interactive things in the community, including field trips. They have volunteers who come and do quilting and weaving, and they have potlucks for their staff. It's for anyone who goes into that, it looks like a house and it feels like this home when you walk in. So it's really kind of a beautiful program that I feel very lucky to have. They have a little playground outside for the little kiddos. It's just really kind of a cool space. And we have the care coordination education. So again, the federal guidelines, we are required to provide parenting education to our targeted population. So we try and do that. We try and get them established with doctors and services in the area. We try and make sure that the youth are on schedule and seeing their doctors and making all of the things so that little family unit can be as healthy and moving forward the best way possible.
Has this county ever considered opening a perinatal residential?
I know many people in the county have inquired about that and have wondered about that. I don't know that the county itself it has the capacity to take that on.
Mm-hmm.
But I think if an individual in the community would love to do that, I would support you 100%.
Isn't that the one that they passed the city last year?
So Crossroads is going to allow housing for individuals who are pregnant.
Yeah.
But once that person gives birth, it's not going to be able to have a sustained way of keeping individuals in there. So it's more of a shorter term housing. And they might change that.
I think their goal, when they presented at council, their goal was at least 6 months.
That is true.
I don't know if that.
But 6 months post is still infant and
Yeah.
not crawling, right?
Yeah.
And so it's that next step for the up to age 6, I think that we're talking about, that would
Yeah.
get more of that perinatal program. So we have packed housing that some of our individuals and participants participate in. And so that is one area that they can have children and their family unit. And I think that we can use a whole bunch more than we have.
Yeah.
It's nice because, I mean, that's something that would be paid for. It's a complicated program, but Drug Medi-Cal pays for, residential perinatal. So.
Like I said, I would love to see that in our community.
Yeah, it'd be great.
So, anyone has the gumption. The
I think
finances.
it's kind of money, yeah. It's also gumption, meaning not a lot of money.
But we'd also probably take a community partner, like.
Oh, definitely.
Oh, so much so, yes. And apply for grants and all of the things, right?
It's all of the work to develop the idea and cost it out and do all the, the program and project development that would be great to see.
It would be. Next, I'm gonna talk about our dual recovery program. So all of those that I just mentioned, again, are part of our serving in drug treatment for individuals who are not open to county behavioral health or are not usually open to county behavioral health. I can't say that none of them are, because some of them are. But our dual recovery program is specifically for people who have co-occurring disorders, with both severe mental illness and a moderate to severe substance use disorder. If someone has a mild substance use disorder, I'm going to send them to an outpatient counseling, even through the county, as opposed to bring them into group, because of the severity of that we're working with. So we would much rather have someone not get new ideas. So, but we do want to help support people towards recovery. Again, I do have our own next slide, so I won't get ahead of myself. So it's located also at Second and D. So the dual recovery process, I'm all in one building, pretty much except for Healthy Moms. And Family Wellness Support, Family Wellness Support is up in McKinleyville. But the rest of the programs are all a part of the Second and D. So the dual recovery program has a different address because you enter on a different street, but it is the same building. We are primarily on the 3rd floor. That's where the clinicians are, and that's where our groups meet. We are fully integrated with HCPR though. So all of the substance use disorder counselors participate in the dual recovery groups, and our clinicians participate in the groups for Humboldt County programs for recovery. So while the criteria is different, the staffing is similar, which means if I have someone that comes to me and I'm not sure which group would be best for them, any of my staff can tease out what would be more appropriate for Humboldt County programs or more appropriate for the dual recovery program. So they do that pretty seamlessly where they're able to navigate that. And if they gets wrong, they're also able to help that person find the group that is the most appropriate. So I just love the way we're so integrated. So how to access is to be open to mental health. We provide case management. We also provide individual services if needed. We provide 10 groups per week. So I don't know if you guys remember that, but the 15 groups and then the 10 groups. So my staff is providing 25 groups per week. We have a women's outpatient and a men's outpatient. We have a community group where both men and women are invited to attend. We have an early recovery group that is for individuals who are actively using substances and don't really want to give up substances. We have our recovery cafe. Most of the individuals who participate in recovery cafe are also part of CCT. Many of them are conserved. And recovery cafe happens up on the Wood Street campus. The rest of the groups happen down here at Second and D. And then we have an aftercare group. An aftercare group is again reimagining what life looks like without substances. And when we have a foundation of health for our mental health and for our substance use recovery. So it's getting out to the community. It was, I don't know, my favorite groups. I should probably not admit to, but it's the men's group and the aftercare group. But the aftercare group, we would sit down with clients and let them brainstorm what they're interested in participating in the community. And then it was our job to try and fit that in and to schedule it and make a calendar of how we were gonna help them meet their goals. So that included going to Avenue of the Giants or going to the Visitors Bureau where it's all chaotic when 100 people crammed into a little building and walking individuals through their mental health symptoms in real time. And then we would go to the river and have a barbecue and kind of decompress after. So it was a way to how to engage in our community for areas that we may have been kicked out on. They may have asked to never return. They may have never experienced, like I'm taking individuals on the Medicaid. I had people in tears because they said, not only have they never done it, but like I would never have had this experience had I not found my life without free of substances. So it's really kind of this whole comprehensive group where we've had many who have been in early recovery who have said, I never ever want to stop using that. That's great. Let's use without dying, right? Like, but let's have that be our baseline then. And then slowly but surely, because no one was telling them they had to stop. And many of those people have sustained sobriety and have been free of their problematic substance use for many years. Well, someone who is being accepted into dual recovery needs to have an active substance use disorder. That means within the last 12 months, they need to have met that criteria for a substance use disorder. Individuals can continue in dual recovery forever. So if there's comes a capacity thing, then we make sure they're just attending the recovery groups instead of the active treatment groups, but it's so they can get as much support as needed, because mental health and substance use they never go away, right? It's part of a lifelong healing journey. Yes, ma'am.
So are all of the programs then harm reduction based and not like abstinence based?
I have a couple of groups that are abstinent based, not for dual recovery, but for ACPR, and Healthy Moms also has some abstinence because of the perinatal population. But harm reduction is what all of my programs are part of. And we have found that when people have enough freedom to decide for themselves, they not only give up their hard substances, but they're giving up cannabis and they're giving up alcohol and they're giving up tobacco. So I have people who are now free from all of the above just because they finally have the room to make all of those decisions on their own.
The two groups that you were talking about, you said that they were your favorites. You talked about the men's group and the aftercare group.
Yes.
So the aftercare group, is that the group that you were talking about? They go into the community and kind of relive. I just kind of wanted to
They
make
are.
that.
I also, all of our groups can, so I can't just say that. I've taken all of the groups to the zoo. I've taken all of the groups to the bird sanctuary over by Lolita. I've taken all of the groups on walks around Old Town and up the trail and over to the bridge and back. So, and we've taken cameras and let them explore photography and taking pictures, and then they get their film back and then they can see what they took pictures of. Because it's this, how do I participate in the world? How do I find joy in the world? What are my next things that are gonna bring me the satisfaction? Maybe not ever that substances did because of the way it blows out our dopamine, but how can I find meaning in my life and purpose in my life?
Do you have a pretty seamless way for people to go once they turn 18 from the adolescent treatment groups to the adult programs?
Yes. And some of my adult treatment, some of the counselors, right now I don't have a female SED counselor for adolescent treatment. So my adult clinicians for CPR sometimes take on female youth clients. So again, we really try and support each other for all of the programs. Updates. So these are just updates that affect substance use disorder treatment or individuals who have substance use in my programs in a general sense. So we have utilized SubG funds, which is a federal funds, it's the Substance Use Block Grant. to provide recovery residents. And in the past few years, the only recovery residents that accepted or that filled out the proposal and that we were able to contract with provided housing to men. And so they have recently opened up a women's house. And so we're able to provide housing for up to 14 individuals, and 4 of those are with women.
Where's that?
Fortuna.
Oh.
So one of the goals of the recovery residents, so when we were doing this contract, so many of our clean and sober houses, if someone uses, they sometimes get kicked out for 3 days, sometimes a week, and some they can come back, or maybe they can't come back. Our goal, since relapse is often a part of recovery, our goal is to have a house that they wouldn't immediately be kicked out of. So we have a house now for individuals. I can't say that they can't use, but they're not going to be kicked out immediately upon use. And they will work with the individual to get them back sober, and they will work with the individual to make sure that they're connected. And if that continues to happen, it takes a house vote to for them to no longer be a part of that house, and the person we work with who manages those houses can override that. So
They can't?
They can.
Oh.
So they can override the house vote, so we can still have an individual stay if it's appropriate.
Oh, I see.
So it's not just about personality.
Popularity.
Right. So I love the idea that we now have a housing opportunity for individuals who are engaged in groups, because that's part of the criteria is they have to be engaged in groups and getting treatment. There's to receive this funding, but they do have this funding opportunity available. We also, Paul had mentioned the traditional healthcare practices at the bottom of that slide. If you want to go back one. So as of July 1st of this year, I think it was actually March when the behavioral health information notice went out. But we have the traditional healthcare practices and are part of the drug Medi-Cal organized delivery system. That means the individuals who are affiliated with a tribe can now have traditional healing practices and natural helpers paid for by drug Medi-Cal, which is fantastic and about time. So we're using natural supports, natural cultural based healing does not have to be evidence-based, because traditional healers and natural helpers don't have that tons of research necessarily behind it. So, but the fact that we can now pay for what is best and right to do for individuals to get reestablished in their cultural communities is super fantastic. So we have 2 eligible providers in Humboldt. Currently, the UHS is already approved. They're also approved through partnership for DMCODS services. So they are, I haven't been able to connect with anyone there to see if they're actually starting to bill for that yet, but that's where we are with that. And then Kamau is in that approval process. So they just resubmitted a bunch of policies and items that they needed to have their application continue moving forward. So, but you know, and when I was talking with Canal, they said, you know, this is what we do with all anyway. This is our healthcare. And so we're just really excited that for drug Medi-Cal organized delivery system clients, that now they can have what is needed and appropriate paid for through their cultural practices as well. Okay, now we're ready to go. So Prop 36 is for individuals who are charged with possession of different controlled substances and have 2 or more related convictions. And they may be offered a treatment mandated felony route instead of incarceration. So instead of being incarcerated, they can choose to do treatment. It is, we're still working out some of the fights with that. Just to be really honest. But it is something that we are actively trying to figure out and offer to our community. It is already being offered. We already have individuals who are in our jail who have been offered this and accepted it and are going to residential treatment. So my hope is that once they leave residential treatment, then they'll start to work through the levels of care, going back down and getting at the outpatient. Yes, Kelly.
The person who asked this question here earlier isn't here right now, but if you receive a referral for somebody in custody, how do you get them assessed to get treatment so that they can be released?
So that is such a great question. We had an SCD counselor in the jail. And that SCD counselor unfortunately is no longer with the county. But we have clinicians in the jail, and clinicians, it is a DSM diagnosis and clinicians can assess for that. And clinicians can do the ASAM if the county is willing to train the clinicians to be able to do that. So that might be one possibility.
You don't have counselors that can go in to the jail and do those assessments?
There is currently,
Yeah. Okay.
first of all, I'm working at a 60% capacity.
Sure. I just.
And 50% capacity at Healthy Moms for my SCD
Yeah,
counselors.
okay, all right.
So that is not something with doing 25 groups per week that we can add to our caseload. But we do desire that to happen and we do want to support that. We're just not sure what that looks like. I know just recently I was asked, can we do it via telehealth? Well,
That's been huge.
that's
The jail.
maybe. Can we?
But then that takes jail
And-
staff to hold that like
And
it's
then,
a whole other.
and then they're in custody, and so with our being a short dwell system, is that reimbursable because we're not an ECM provider?
Yeah.
And I don't know that it is, like, so there's a whole bunch of nuance, which is why I said in my initial statement, is it's complicated. We're trying to work out some of those complications right now. So, we thought we had a plan and then we got thrown for a loop and now we are coming up with plans. Okay.
How long is the process to get the clinicians that are in there certified to be able to do those assessments?
They're already overburdened though, and there's only one clinician and there should be 4. So like the ability for that clinician to also take on substance use disorders
So,
responsibilities seems,
so my goal,
Yeah, I mean, but it's also
Not
people sitting there not,
yes.
sitting there in jail that shouldn't be in there.
But there's a lot of folks that have mental health disorders that
I
are,
know.
yeah, it's true. And this is just
Catch-22.
anecdotal experience
Yeah.
from the past, not.
so my transparent goal that I have not shared with the directors or the deputy directors.
Aspirational.
Oh. How much of the bus is gonna hit me, but I've seen in other counties where they train all of their clinicians throughout the entire county on how to do regular assessments and how to do ASAMs.
Right. Yeah.
And as we move towards integration, I think that that would be really
100%.
beneficial for our county. I think that at every
No wrong door.
spot where an individual may come see us, we need to be able to assess for what's going on. So my team right now, Healthy Moms can assess for behavioral health. Dual Recovery can assess for behavioral health. If an individual comes through HCPR, they can get a hold of one of the Dual Recovery clinicians and I'll have them assess for behavioral health needs. Right, so my programs can go both ways. And my heart of heart would desire that to be the same and reciprocal for wherever somebody is able to touch our system. So if they come into Wood Street, I would love for them to be able to get an assessment, and if the most appropriate assessment is an ASAM, that would be my heart of hearts. I do not know if that goal is shared by anyone other than myself. So I will take that on as my own secret, not so secret now, because I'm taking it in this meeting, desire. But I do think that as we're supposed to be integrated between behavioral health and substance use, January 1st of 2027. And so as we move towards integration, I think that that's one of the many, many steps that could be beneficial for our county to take. And I think that will have this added benefit of reducing stigma. So I see Vernon and then you.
Oh, no. So sorry, does anyone have a white Buick out there? Good, keep going. Sorry, a car sustained damage and they would have needed to go out there right away.
Oh,
Thank you for letting us.
thank you.
It does.
So I think that just really paying attention to how we can merge our county into being able to help all of the individuals who walk through our door at any given time is gonna be super helpful. Bernie, I saw your hand up.
No, I'm just pointing to back.
Everybody wanted to do that. Okay, is there any other questions about Prop 36 and the fact that we still have kinks to work out, but it's still a great program? Okay. Next is SB 43, it's Senate Bill 43. And I'm sure you guys, many of you have already heard that it expands 5150 criteria.
Yeah.
To have substance use, severe substance use as one of the qualifying diagnoses for 5150. So most counties have reported they haven't seen a huge increase in their 5150 holds. So I will say that kind of anecdotally, that most of the individuals who they see still have an underlying mental health disorder as well. But we do have some, right? But and severe alcohol use was already part of the 5150 criteria. So now it's just figuring out a way that all of our locked inpatient units or some of can treat substance use disorders without having people suffer the difficulties of withdrawal and the complications that come from withdrawing. The next one on that slide is the Behavioral Health Service Act. So the Behavioral Health Service Act, we used to have dual recovery as part of our MHSA dollars. And now the state has said, instead of having Mental Health Service Act funds, we're going to have Behavioral Health Service Act funds. And what does that look like? And you can use part of that money for individuals who have substance use diagnosis as that qualifier as well. And so we are working together with the Mental Health Service Act folks to be able to figure out exactly what that means for our county and how we want to use those funds in our county. Again, that's going to be part of our 2027 integration, right? So not only do we need to integrate all of our systems, but we're also integrating some of the funding that's been primarily used for mental health services.
Without extra funding, I think.
Yes,
correct?
ma'am. Oh, no.
With less.
Do more with less.
5% less.
So I've said up there is expanding funding to include substance use disorders. It coincides with having the integration by 2027. It's promotes the full integration by allowing that coordinated care and shared data and streamline referrals. And it's trying to increase flexibility. And I will say that when you are always, you never are like, oh no, I have all of this money, I don't know what to do with it. And then they're like, please divide it again. I think it creates conflict. So, but I also think that it's a really great way to, if somebody needs a pair of glasses and they're part of our substance use disorder program, to be able to provide a pair of glasses. And we do that for our individuals who are part of our mental health programs, right? So I think that there is some really great practical things that we can do to really help all of our clients. And then next slide is my last slide almost. So Narcan, so we're a part of the naloxone distribution project. And we have distributed over 700 boxes of Narcan to our community partners, to our different living houses, to different tabling events. I just saw that we're providing another 144 plus to another department. So we are doing everything possible to get Narcan into the hands of those that need it. My goal is to pass it out like Halloween candy. So I've been really transparent in that goal. I want everybody to have it. I want it to be a part of your first aid kit. I think that if we have it and carry it, then we can help people not die from use. Right now, it's often taking 4 doses of Narcan to bring somebody back. So if you're gonna have Narcan on you, please make sure you're having are the boxes we distribute. We should have 2 doses, so make sure you're having multiple boxes of Narcan. Yeah.
To piggyback off of that, I have personally experienced having to resuscitate someone about a good month ago with about 3 doses of Narcan back to back. I had to do a 5-minute, about 2-minute intervals each dose. So just, I would highly recommend all of you, if you do have it, keep a lot of it around you. It is taking quite a high dosage to bring people back.
Yeah.
So, yeah, I have seen that myself.
And always call 911 if you're administering Narcan. Like those 2 things should.
Yes.
Administer Narcan, call 911.
Yes.
And Michelle and I are about to put in another order of Narcan because we ordered like 500-ish. That's enough that we're about to get rid of a whole bunch more, but we're gonna order some more. So we'll again have this a supply so we can just be passing it out as people need it. I have it like a giving tree in one of my lobbies where they can just come and take as much Narcan as they want or need. I also have baskets in my other lobbies. With those baskets, I also have 10 little test strips. So I think the more we can help people know what they're using, the better it can be. I have had many people who've tested them up and it had fentanyl in it and they decided to not use that meth.
Wow.
So they've also decided to use smaller doses of that to see how effective that, right? So like, I have both, but at least they're not taking their original dose and then overdosing on that, right? So we have some really good things that we're doing in the substance use world. And I have way too many fentanyl strips sitting in the office. So if people need them, please let me know and I will distribute them. Just willy-nilly. And then the last thing I just wanted to say is, we have had a contract with Cal Poly Humboldt for interns, for our social work interns for a long time. And for College of the Redwoods, we had a contract, but we never had a contract for our substance use. And prior to me, it was one of those things where we had interns come in and go, but it wasn't really an official relationship. And then I was asked to get an official relationship in place so we could start accepting College of the Redwood interns again. And now that is in place. So we can now accept interns from College of the Redwood for our substance use disorder program, and we can still accept Cal Poly Humboldt. Awesome. Okay, that's it. My next slide is what questions do we have?
With 5 minutes left of our meeting time. I know. Thank you so much. Well worth the wait. Joe, I hope you can send the presentation to the health board. There's a lot on there. Kelly, you have a short question?
I do. I have a question.
We do have some, I can talk about that in a minute. Yes.
Just for everybody's knowledge, how long does it take to get trained in ASAM and how are those trainings provided?
So ASAM right now, I have, it's multiple hours per ASAM. I think that it takes 2 days. It's not.
Is it online or in person?
It is an online training. Correct.
Does it cost the county money to send people to it?
I have currently, yes, probably, but I have currently only done it through our DMC ODS services, which is brand by partnership because we're in that wellness and recovery model. And so right now it does not cost the county because partnership is providing that training to DMC ODS treatment staff.
Can providers get CEUs for it?
Yes. All of that, yes. We're also, as of January 1st of 25, we were supposed to go to the ASAM 4 in the state of California. California decided, rightfully so, that we didn't have the infrastructure in place to move to the ASAM 4. It will change all of the levels of care. Every single level of care will be a new number. So between that and all of the other things in place, California decided, hey, let's pause on this. And we said, fantastic, thank you. So it was supposed to then roll out in July. It did not. And now the state hasn't given us a new time frame for that to roll out. But with my goal of eventually getting all clinicians trained, maybe when that new ASAM rolls out, then we will be able to train people in person and have it be a wider accessible thing for staff. And then we also were just talking about how in a different county, they have Narcan vending machines essentially. And we also have those in Humboldt. So we have Aegis has done a really good job, and I think there's another, I don't remember who right now, but they have some over in the Yurok tribe, they have some over at Hupa, they have one in Willow Creek. They have the VA. So we have tried to have multiple vending machines. Some of those are actual vending machines themselves, and some of them are just display cases with the Narcan on that you can take. With the vending machines themselves, you're supposed to put in like your birthday or whatever, but you can say today is your birthday. And it gives you the thing. It doesn't have to be accurate information.
Okay.
It just has to be information. But then you can get Narcan through a variety of different ways. And also a reminder that your emergency room also passes out Narcan without asking you any questions.
Okay, so we've been given our kind of where I work, for our emergency kit. How often does it have to be replaced?
Has an expiration date on it.
Okay.
So so what the professionals say is it is good to use up to a year after that expiration date without using any of the effective.
And also I've been trained that if you have expired Narcan and you don't have access to any other, it's better to use the
It's better
expired
to use
Narcan.
And I will also say as a trainer, one of the trainers who came to us, well, it was in an injectable pen, not the nasal that we're currently using, was showing a demonstration and actually injected herself with live Narcan instead of the training pen. And nothing happened. Absolutely zero. So don't be afraid of using Narcan with any ill side effects, because there won't be any side effects unless there's opioids in the person's system. Okay?
That's interesting.
Okay.
All right, awesome. 14:14, 1 minute early. We will adjourn this meeting now, and if you have other questions, I'm sure that Deanna would answer them for 3 minutes. So thank you, everyone. Thank you, Deanna. Thank you so much. Thank you, Deanna.
Cool.